Hi, I'm Dr. Sam Lamb. I'm the program chair for the annual ISHRS Congress in Berlin, October 23rd through 25th. I'm here with Ángela Hermosa, who is one of our featured speakers. She is a dermatologist, trichologist, as well as a hair surgeon out of Madrid, Spain, and she's going to be talking about mesotherapy for androgenetic alopecia. So welcome, Ángela.
Hello, everybody. Thank you very much for inviting me to participate in this Congress.
We are happy about that. Could you tell us a little bit about what mesotherapy is and how you use it?
Of course, mesotherapy is a procedure in which substances are directly injected into the scalp to promote hair regrowth. I usually use mesotherapy in patients with androgenetic alopecia, both males and females, to optimize the results of the oral treatment, and sometimes we as an alternative for example, patients who are very concerned about potential side effects of oral medication.
What do you inject?
The drug I use the most is dutasteride, but sometimes I also use PRP or bicalutamide, and in very few cases I can use also minoxidil.
How often are you injecting the dutasteride?
At the beginning of the treatment, I usually inject dutasteride every 3 months, and after like 1 year, if the patient is well controlled, I can spare the sessions of injections, and I can perform twice a year, for example. It depends on the control of the patient, and also it depends if the patients want to take oral medication or not.
Do you do the dutasteride for non-childbearing women as well, or just men?
I and my group use usually dutasteride not only in males but also in females. But we say the patients, the woman, childbearing woman, that they should use contraceptive methods.
And do you mix the minoxidil injection with the dutasteride?
But not in the same syringe.
Okay, so but in the same
I
session?
usually use different syringe, but in the same session, you can inject not only dutasteride, but also minoxidil or PRP, for example.
Okay. And have you seen the efficacy of injectable dutasteride? Have you studied that compared to oral dutasteride in terms of the benefits?
We don't have scientific studies, but in my experience, oral dutasteride is more effective than injected dutasteride, but it's a good alternative for patients who don't want to take oral medication. And in my experience, mesotherapy with dutasteride also improves the results of oral dutasteride.
So you
and
mean
sometimes and sometimes I with patients that are with both oral and injected dutasteride, and I stop mesotherapy with dutasteride, sometimes they can suffer a worsening.
interesting. So you're actually combining both oral and injectable dutasteride in some patients.
Yes.
How do you
Yes.
decide that? Is it someone that is not getting they're not getting the benefits all the way with oral that you add the injectable later on, or do you start them on both simultaneously?
It depends on the case. For example, if I am if I am with a patient with a very severe androgenetic alopecia, and the patient is very young,
Yes.
I treat the androgenetic alopecia very aggressively with
Right.
both of them. But in most of cases, I usually start with oral dutasteride, and if the results are not the best, we can add mesotherapy with dutasteride. But sometimes here in Spain, it's very typical that the patients are very concerned about potential side effects of oral dutasteride. And it's very frequent that patients don't want to take daily oral dutasteride, and in that cases, I usually give the patients, for example, 3 times per week oral dutasteride, and I combine with mesotherapy with dutasteride to improve the results. It depends on the case.
Have you seen side effects with the injectable mesotherapy dutasteride, sexual side effects with the injection?
Not systemic or sexual side effects, but the most frequent side effect of mesotherapy with dutasteride is pain. So
Okay.
I usually perform local anesthesia before making the procedure, and in this way the procedure is very well tolerated.
Why inject minoxidil versus topical or oral? Do you find a benefit to injecting it?
Not really. It's not the procedure I perform the most. I really don't like to inject minoxidil because in my experience is the most painful kind of mesotherapy. But some patients, when they are anesthetized, they ask you, please inject me everything you can inject in the same session. But it's not the most frequent mesotherapy I usually perform. Because of the half-life of minoxidil, this should be a very frequently procedure. For example, it's very comfortable for patients to come to the consultation every 3 months, but I think that because of the half-life of minoxidil, it should be performed every 2 weeks, and
It's
in
very
many
difficult.
times that's not very comfortable for the patients.
Do you also inject, without going into too much detail, do you also inject vitamins or exosomes or stem cells or anything else, or is it mainly dutasteride?
Mainly dutasteride and PRP. I have also experience with stem cells, Regenera, but it's a very expensive treatment for patients, so it's not the procedure I perform them with very frequently.
Wonderful. Well, we're not going to give all the secrets away. She's going to give you the recipes of how she does it specifically. You have to come to Berlin, October 23rd through 25th, as I mentioned. And we look forward to hearing Ángela go in a lot more detail. And I'm going to get her on some panels, and we're going to hear a lot more from her. And hopefully she can stay for the coffee with the experts. And so you're going to get a lot of FaceTime with her. Thank you so much, Ángela. We appreciate your time today.
Thank you very much.